Okay, our last video, we are going to talk about nebulizers. There are so many different kinds of nebulizers. So we're gonna start with the basics. So this is the basic typical nebulizer that you will see in the hospital. It will come with all these pieces and oxygen tubing. Let's go over each part. So inside you have this blue piece. That's the baffle. So the oxygen tubing, blue to blue, is hooked up on the bottom. So you have your air or your oxygen, whichever gas you're using, will compress the gas, and you'll put the medication in here and it will baffle. So as that compressed gas is moving the liquid around, as it hits this piece, it's shattering that liquid into smaller particles. And then you have the top. You screw it on like that. And then you have a T-piece and a mouthpiece. Excuse me. And then it'll come with 6 ml corrugated tubing. And what this is doing is when you're breathing on it, the mist is going to come out, but it's not all going to be lost. So it's catching during exhalation what medication can possibly be lost. If it was like this during exhalation, it would just be gone and into the patient's room. Okay, so let's do a little bit, borrowing Marilyn's hypertonic. Okay, so we are going to use her compressor. So this is what a patient would use at home. So at the hospital, you'd hook the oxygen tubing to the flow meter, whether it's gas or oxygen, either is fine. Here, we're just gonna use a little air compressor. Marilyn likes to put stickers on her stuff. So this is a Perry brand. The on-off button, this is where we are going to connect the oxygen tubing. And then it has a little filter here that you change about every 6 months. Okay. So we are going to put the medication in here. I'm just gonna do a little bit. And I couldn't find a new one on campus, so I'm not gonna actually breathe out of this one. I just wanted to demonstrate. So compressors are louder than gas. And you can see it misting. So if you have your corrugated tubing here, you're still losing some, but not as much as if it didn't have that extra space. So this is a good way to tell. You can tell when the patient's medication is done because it's still misting. So you can see now how that medication has been baffled. So let's say, I have a cup over here. So let's say you think that it's done. So this is the sputtering sound that I spoke about during the lecture. You can hear it sputter. So that's when you know it's done. It's still misting a little bit. You're gonna have those patients that just wanna tap, tap, tap until it's done. Because then you can see some more. And they'll just keep tapping. Even though there's some residual liquid still left in the cup, at this point, that's gonna be the carrier liquid. You're not gonna get much more medication. Okay, so that is the typical small volume neb that you are gonna see in the hospitals. These are cheaper. You're gonna have patients ask if they can take them home. Most of the time, either get them a new one just to tide them over, but refer them to their primary care doctor or their pharmacist. Okay. So now we're going to talk about breath enhanced. Now there's a difference between breath enhanced and breath actuated. So breath enhanced, remember, it has those series of valves and flaps that help keep the medication in. So this is one example. On the mouthpiece, it has a valve on top here so that when they're exhaling, it's not going to be lost like it would with the reservoir here. It's going to keep it in the nebulizer. It has a valve on the top. So when you go to put medication in, if you see one like this brand exactly, you just pull that valve out and then you'd pour the medication in. In this cup, this is the baffle. So it has this baffle and then this one on top of it as well. So that's going to help to break it into even smaller particles. If you work at Children's or St. Joe's with the CF population, you are going to see this one a lot. This is actually Maryland's, so I'll show you how it works. So in here, this one's a little harder to see on the inside. You have a baffle down at the bottom, and then the mouthpiece, and this is going to prevent on exhalation, or on exhalation, it's going to hold some of that in. It's going to let her exhale because we don't want to rebreathe our CO2, but it's going to hold a lot more medication than if they were using just one of these regular small volume nebs. And then this is another baffle. So this goes on top of that cone that's inside, and it's going to help generate smaller particle sizes than a traditional nebulizer. A tip with these, I learned the hard way. So you see a circle here and you see a circle here. They need to match up. If they don't match up, and you can put them in this way and screw them in, this top part's never coming off again. You'll have to throw it away and get a new neb. And there's also a valve on the cap. And these valves can be removed for cleaning. So you can see how it would vent. Without that valve, you're gonna lose the mist. You're gonna lose the medication. And then the little valve can just go on top. Now, when you are cleaning these, remember with nebulizers, they need to be cleaned after each use, or at least rinsed out while you're in the hospital. And then at home, they need to be cleaned after every use with dish soap and hot water. And then you can either boil them, soak them in a vinegar water mixture, or put them in the dishwasher on the top rack if you have a sanitize or antibacterial mode. Okay, so let's show you this one. So in these ones also come with their own specific tubing because they fit it the proper way. So every nebulizer you get is going to come with its own tubing. So I will show you this. And there's just a little bit in here. So we'll start the compressor again. So you can see you're not losing as much medication. So if you take some big breaths, you can see it kind of missed on exhalation out here, but you're not using as much medication. And remember, you want to watch and make sure your patient isn't breathing through their nose. Hypertonic. So it's making me cough like it should. Okay, so that's the peri-neb. So those are both breath enhanced. They're going to mist, they're going to work whether I'm taking a breath in or not. Okay, this is a breath actuated. So it's a little bit larger. It has the baffle in the bottom, but this guy, I can't take it apart, let's see. Has a spring and a valve in here. So you can see the valve, the spring here. So as you take a breath in, it will pull that spring down and draw the breath, the medication on inspiration. This is typically more common in patients who are getting PFTs done, specialized PFTs. Let's see. Okay, so when you go to the Pyxis, this is typically what your single dose is going to look like. So this is an example of so ipratropium bromide and albuterol. So you're gonna open it, Never use your teeth. It may sound like common sense, but a lot of people use their teeth. And if you do that in front of your patient, you've just lost all credibility. Plus, that's disgusting. Okay, so with this one, see, there's no mist until you inhale. And this is not brand new, so I'm not gonna inhale. So a patient would, and it would trigger that breath. So if inspiration, so this is breath actuated. Excuse me, it's still that hypertonic saline. Okay, so those are the basics. Be able to identify the different type of nebulizers if you see a picture. So normal small volume neb, breath actuated, and then we have two different types of breath enhanced. Okay, if your patient cannot hold the mouthpiece in their mouth, or they are really little, or they're really sick, or sometimes at night, I have had patients who say, I don't want to be woke up, but I still want my treatment. Would you just put a mask on my face? That's when we would grab an aerosol mask, because it just fits right on top like this. And then they can hold it, or you can put it on with the elastic so it stays on their face, and this little metal piece will help adjust it. It's really one size fits all, or one size fits most for adults. And then kiddos have different size masks. So here's a little pediatric one. There's different size masks, and you can always ask mom to help you hold it if they're more comfortable with mom. And then another common one you'll see is the little fishy mask. This is Perry. They're a little more expensive. They stopped having them at Children's Hospital and CF Clinic. You can buy stuff like this online on Amazon if your insurance won't pay for it. All right, please reach out to me with any questions.